This video is an instructional guide on how to properly don and doff personal protective equipment required for team members caring for persons under investigation for the 2019 novel coronavirus or for those who have tested positive for the virus. The supplies needed for donning include an N95 respirator or a PPE for your fit testing requirement, exam gloves, disposable isolation gown, eye protection, which can be a face shield or safety glasses. Just remember that regular eyeglasses are not considered proper eye protection. Of note, it is important to have an observer with you read each step of the doffing process to ensure your safety. The observer will halt the doffing process if any breaks in the technique are noted. If a break in technique is observed, hand hygiene is to be performed and corrective actions taken before doffing continues. Dorothy is caring for a patient under investigation for novel coronavirus. She will don her equipment in the anteroom of the patient's isolation room or in the doorway if an anteroom is not available. Step 1. Dorothy must perform proper hand hygiene. After performing hand hygiene, Dorothy will next apply her isolation gown. She'll fasten the gown in the back with the waist ties and ensure the thumbs are through the thumb holes. Following putting on her gown, she will then apply her N95 respirator. To do this, she will cup the respirator in her hand and place against her face with the nose piece facing up, bringing the bottom strap over her head and positioning just below her ears. Then she will bring the top strap over her head and position it above her ears. Using her fingertip, she will mold the metal nose piece against both sides of her nose to create a seal. To test the seal, she can gently press both hands against mask while exhaling and feel for leakage around the seal. If air leaks from the mask, you can readjust the metal nose piece until it stops, or a different size N95 may be needed. Following putting on the N95, she will then put on her eye protection. Today she is wearing a face shield, but she could also use safety glasses. The supplies may vary in your area. Now it is time to apply exam gloves. While donning the equipment is relatively simple, as many of you have done this quite often, doffing of this combination of PPE can be a little trickier, and it is imperative you work with your trained observer who will use the established PPE removal checklist to ensure you properly remove your PPE. Let's begin the doffing process. Dorothy will first remove her isolation gown and gloves. To do so, she will grasp the gown in front and pull away from her body, breaking the ties in the back. So when you do this, you touch only the outside of the gown with gloved hands. Next, she will fold or roll down inside out into a bundle, also removing gloves at the same time, only touching the inside of the gloves and gown with her bare hands. The gown should be discarded in a waste container. Once she has removed her gown and gloves, she must perform hand hygiene. Then it is on to removing her face shield. To do this, you lean forward, grasping the sides of the shield, pulling it up and away from your face. In the event you are wearing safety glasses, you would do the same thing. Grasp the sides of the glasses and pull it up and away from your face. It is very important that you do not touch your face. Then Dorothy will once again perform hand hygiene. It is now time to remove the N95 respirator. Again, you do not want to touch your face when doing so. You will also not touch the front of the N95 mask. Instead, you will grasp the bottom strap and pull that over your head. Then grasp the top strap and pull over your head. Discard this in the waste container also. Finally, Dorothy will complete the doffing process by performing hand hygiene one more time. While many of you will use the N95 respirator, some may have to use a powered air purifying hood or PPE. Donning and doffing with the PPE hood is quite similar. Let's go through the process now. Step 1, Dorothy must perform proper hand hygiene. Next, she will inspect and then apply her PPE. To inspect, she first turns the PPE on and performs a safety check, ensuring full battery and that the filter is installed in the blower unit. as well as confirming there is adequate airflow into the hood. Once you have completed your safety check, secure the PAPR blower around your waist with the belt. You will then place the PAPR hood over your head and use the headband to secure the hood. After she has donned her PAPR, she is ready to apply her isolation gown. Fasten the gown in the back with waist ties and ensure your thumbs are through the thumb holes. Lastly, it is time to apply exam gloves. Now let's begin the doffing process. While removing your PPE, it is imperative you work with a trained observer who will use the established PPE removal checklist to ensure you properly remove your PPE. Dorothy will first remove her isolation gown and gloves. To do so, she will grasp the gown in front and pull away from her body, breaking the ties in the back. It is important that when you do this, you touch only the outside of the gown with gloved hands. Next, she will fold or roll the gown inside out into a bundle, also removing gloves at the same time, only touching the inside of the gloves and gown with her bare hands. The gown should be discarded in a waste container. Once she has removed her gown and gloves, she must perform hand hygiene. Next, she will apply a new pair of clean gloves. This is because cleaning and disinfection of the PAPR unit is a step within the doffing process. Once gloves are on, Dorothy will remove her PAPR. She should remove the PAPR hood, making sure not to touch her face, by leaning forward and pulling the hood up and away from her body. Once removed, disconnect the hood from the PAPR hose and discard the hood into the trash. PAPR hoods are single-use only when caring for patients with novel coronavirus. She will remove gloves. She will perform hand hygiene and apply a new pair of clean gloves. Next, she will remove the PAPR belt and unit and place unit on a nearby flat surface to be disinfected. Prior to disinfecting the PAPR hose and blower unit, be sure to turn off the PAPR unit. Thoroughly disinfect PAPR hose, blower unit, and belt with hospital-approved disinfectant, making sure to follow the disinfectant's wet time. Then you can remove gloves and discard in the trash. Finally, Dorothy will complete the doffing process by performing hand hygiene one more time. Following this, the unit will remain stored in the department-specific designated location. This may be the storage closet within the anteroom, a PPE closet outside the patient's room, or a designated drawer within a PPE cart. A new PAPR hood will be needed each time Dorothy enters the patient's room. This completes our lesson on how to don and doff PPE for the novel coronavirus. If you have questions, please contact your infection prevention department.